She's like, I cannot understand it, I can't comprehend it, but I cannot deny the results my dog's getting. One of the vets that I actually had over in Australia, she by lunchtime on the first day, she was in tears and walked out of the course. She said, I spent 7 years of veterinary school, and these laymen understand what you're talking about, and I feel like this is going straight over my head because it doesn't match up. She proceeded to go on to the second level, and it was just still like that whole scientific brain doing this, just couldn't gel it together. But the beauty was she brought the dog to level 3, 4, and 5 for us to use because of the benefits her own dog was getting.
Today's topic is about alternative therapies. Hi everyone, I'm Dr. Cara, and welcome back to the Paws Effect Podcast, where we explore science-backed veterinary care, challenge common myths, and have open conversations with experts across the animal care spectrum. In this episode, I'm joined by Heidi Johnson from Intune Animals and Humans. Heidi works with people and their pets using energy-based techniques and modalities that often fall under the umbrella of complementary or integrative care. Now, as a vet and someone who believes in evidence-based practice, I'll be honest, I'm a bit skeptical. But I also believe in conversation, curiosity, and learning where our fields might connect, especially if it helps animals and the people who love them. So today, we're digging into what being in tune really means, where science and intuition may overlap, and what role, if any, these modalities can or should play in veterinary medicine. A quick reminder to share and subscribe to the podcast on your preferred platform. You can also follow me on Instagram as Dr._Cara. Let's get started. A very warm welcome to the Paws Effect Podcast. I have Heidi Johnson in the studio today, and we're going to be discussing alternative therapy. Yeah. And we're going to discuss why we're laughing about that. Yeah. But a very, very warm welcome.
Thank you. Thank you for having me.
Thank you.
Exciting.
So I wanted to have a discussion. Obviously, we are talking to pet owners, and there are vets and nurses who are listening to the podcast. But I've invited you because you do something a little bit different. Please take a moment to introduce yourself and tell us what you're representing here today.
So I'm Heidi, and I'm actually a Durban girl, born and bred in Durban. Grew up here on the East Coast and always had a love for animals. Grew up with dogs, horses as I got older, not my own, unfortunately, but then got married, and my husband and them had a stud farm and a horse trail business. But I've always wanted to help the animals. Never had the marks to get into veterinary. I wouldn't say not the skill, but just it wasn't something that I wanted to go that route. I wanted to do something that wasn't your mainstream. I've always been one of those, like we were speaking earlier, asking questions. Why? How come? What is causing it? And so, I got into the complementary via that. And I've just spent 6 years in Australia learning the Emmett Technique, which is what I'd like to speak more about.
Absolutely. Yeah. So what is Emmett? Start by introducing. What does that term mean?
So Emmett Technique. So Emmett is actually the surname of the founder. So Ross Emmett. And he was born in Tasmania. Emmett Technique is a light touch neuromuscular release therapy. So it's a complementary therapy. It's not there to replace other therapies. It's there to support the vets, the physios, the chiros. And just for the home user, there's a lot of animal or pet owners, horse owners, dog owners that have animals. They have injury or just aging, and they're at home, and it's just going to the physio is either too much for them, it's too costly. And the Emmett Technique is something that they can use at home. So Ross likes to call it the missing link between all the therapies, because sometimes it's just one thing doesn't quite cut it, as well as it's also a muscle first aid therapy as well. So it's quite nice for the home user. However, in saying that, it can be used for the professional as well.
So I like the fact that we laugh because we said, a holistic and alternative, and it sometimes has a negative connotation. Yeah. And the term you use is obviously like a complementary and something that you can add to the treatment regime. Yeah. So, obviously I'm going to cut to it very early on, and let's get the awkward conversation over and done with. I think, obviously we probably have a large number of listeners who resonate with this podcast because they maybe have a sort of scientific basis and they they resonate with the work that we do as veterinarians. Yeah. There may be people a bit skeptical about this. Is that something you face quite a lot?
Very often. Okay. Very often. And we're always afraid of something we don't know. I teach the technique as well. So it's not that I'm just a practitioner and out there practicing it. I teach both the horse and the dog levels right through to practitioner level. And what we see even in the students is that it's because it's so simple. They always say it's too good to be true. So little, and you can get such big results. And that's what I think a lot of the more scientific, if I can put it that way, they find it hard to get their head around it. But the body, be it human or animal, is such an amazing, complex structure that sometimes it's smarter than what we think it is. And it's just knowing the right buttons to press for it to actually activate and start that system going again. And that's why we call it a neuromuscular release therapy. So when we teach, Ross doesn't like us calling the moves by a muscle name, because even though we say we're doing the lats, it might not necessarily be we're working on the latissimus dorsi muscle. But we are affecting a region or area around that. And through the nervous system, fascia's become quite a big topic at the moment as well. And I mean, he's been doing this since pre-2000. So it works through that fascia system, the whole nervous system. And we're basically finding the light switch to turn on the light somewhere in the body. And that analogy is something we use when we teach as well. Often people see the dog limping on the left foreleg, for example, the left front leg, and they think there's something wrong with the paw or the nail, failing to understand that potentially they might have been T-boned and the opposite hip is sore, but it's presenting in that left front leg. So what we're doing is we're going and we're finding the light switch for that light, so the light being the left front leg that is flaring up, and we go and find a light switch. A light switch in the building is never on physically on the light. And over the years, that's what Ross has found and discovered. He worked in animal research, so not the nicest kind of research, but learned so much from there because they worked with animals where they were using them for testing and that. Obviously, a lot of dissecting afterwards. So got to know literally the ins and outs of animal bodies really, really well.
So, I mean, we'll discuss the course that you provide, but just for context now, is there a big understanding of anatomy? So is this something where you're having to sort of teach, like you made mention of the muscles, but you say you don't necessarily refer to it? Or are these, do you break it down into more simple sort of
yes.
Is it like pressure points? How, like I'm going to go about it?
Yeah, so it's a hard one to describe because it's basically using similar to acupressure points. Okay, your acupressure, acupuncture, depending which line of energy medicine you may be in, whether it's meridians and that, it's all points that sometimes fall onto other points, other times not. And it's really interesting. You don't need to know the anatomy in that. It's open for the layman to learn the course as well. Sometimes they're the nice students to teach because they got no preconceived notion. They learn to observe the animal unbiased. They're not looking at it with a preconceived idea of muscles and the biomechanics, and possible conditions, etc., that there are. Other times that stands you in really good stead because what you're looking at just doesn't add up as a picture. But I think that goes in any industry, in any profession, is there's pros and cons to having the knowledge or not having the knowledge when going into something new. But there's no requirement for anatomy and physiology per se. It stands you in good stead the further on you become as a practitioner. And especially if you are one that tends to work with the vets. We've got a lot of dog practitioners and horse practitioners that work alongside the vets or the vet nurses that are using it in the vet surgeries as well. So it really depends where you are placing it once you've got that knowledge.
So tell us, what is the basis of this? Is this myofascial release in the same? I mean, that if that may be a term that people may understand. Is this the same that you're dealing with the fascia? Explain to us what the theory is and in terms of how it works and so, why you see a result.
Yeah. So basically, it's a combination of all of the above. There's no single one answer. So what we're looking at is we're finding what we refer to as an Emmett point. They are usually used as a single point or 2 points connecting, so sort of like a polarity to create a neutral touch. It's a light touch, so therefore when we're going onto a point, we're going directly and a light touch. We're not going in and actually trying to apply a deep pressure into the muscle. By doing that, we are creating a response that gets into the brain and comes back down and releases through it. So a lot of people used to that whole saying, no pain, no gain. And we've realized even with a lot of sports massage and that it's not necessarily you've got to go deep and hard. It provides a temporary relief at the time, but also the body starts to respond to that as a trauma in itself. So with the animals, what we're using is a much lighter touch. It, through the fascia, releases further tension and then in turn goes into the muscle system. We do a lymphatics with it as well. And the interesting thing is sometimes we even get behavioral changes just because of what the muscles are actually holding, whether it be a trauma, whether it be from an injury that it just never ever set back to its neutral position. Some people say it's holding emotions. It depends on your viewpoint of how you're doing it. But we even know in humans, your muscle holds trauma from your life experiences, your accidents, your falls, your bruises, etc. And if not addressed or treated at the time, over time, it's just going to accumulate and you're going to become very, very stiff. And the same for the animals.
Hey there, pet parents. It's Dr. Cara, the Ultra Pet Vet here. Brachycephalic, meaning short-muzzled dogs, have uniquely shaped jaws that can make picking up and chewing normal kibble really difficult. That's why Ultra Pet has created a kibble specifically designed for easy pickup. It contains glucosamine, chondroitin, and green lip muscle extract to help support your dog's joints so that they stay mobile and active. The inclusion of beet pulp and prebiotics helps support a healthy gut by promoting the growth of beneficial bacteria in the digestive system. Omega-3 and 6 fatty acids promote a shiny coat and a healthy skin. Ultra Pet offers 100% money-back guarantee. Try Ultra Pet's premium recipe for short-muzzled dogs today. Sorry, I'm going back a step because I really am interested in this, particularly obviously from a vet perspective.
Yeah.
You know, we know, and I'm going to take an even further step back before I give my comment. There has been a lot of interest recently in some alternative thought processes, not necessarily even in therapies, of breathing techniques and the impact of that on emotion and anxiety and so forth. Light therapy, things that we maybe previously didn't understand from a scientific background or couldn't put measurable understanding to.
You can't quantify it per se. Yeah.
So I'm always interested in how this could potentially be in several years where there is some scientific backing to it. But what is it? I mean, it obviously works. Is saying that there is a placebo something that you hear people say? How do you respond to that, where you say, you know, even the connection potentially, I'm talking about a dog maybe undergoing thing and that behavioral insight and maybe some ability, and the effect is not necessarily associated with what is physically happening, but the connection with the pet. How does that? Yeah,
so placebo is a question that comes up very often, and a straightforward answer that I normally give to everyone: animals and kids don't understand placebo. You know, they don't have that preconceived notion of, well, what they're doing, you know. So when you do it, I mean, if an animal is genuinely sore and you work and you've chosen the correct move, and that's one thing I need to make very clear, is that there's a lot of people that do things in sequences. Emmett's not about a sequence. You use the move applicable to your observation at the time. So what might work for one dog for a limp is not going to work on another dog for a limp. You've got to understand why the dog is limping. You've got to be observing it. Therefore, it's not a placebo. It's not that same move gets used all the time. So often the students will ask, what moves? I've got a dog presenting this. What do I use? And we go, well, we need to know more details. What's the scenario surrounding it? What else is the dog doing? What sort of surface is it walking on? Is it always walking on a wooden floor and slipping out all the time? Has it had a previous injury? You know, what kind of bed is it sleeping on? What kind of harness is the person leading them in? So it's not just as simple as, oh, the dog's got a limp. You've got to observe the full scenario around it. And that's what comes back also with that whole placebo thing, is that we've got to be very, very careful when explaining it as well. Ross has done a lot of research when they did it actually in the UK, where they had horses on treadmills connected up to all your fancy machines and that, where they were measuring stride length, for example. So with the race horses, and, you know, obviously measuring the stride on the walkers and that, would then perform an Emmett move and see the change in gait length that the animal was getting, or respiration rate, etc. So there is the scientific, but not enough to warrant an answer for the vets to the degree of what they're wanting. And the hard part is, with anything alternate, is to try and get people to do that research. So if we do it, it's not classified as scientific enough. So that's the hard thing, but it's to actually get the scientific community that is open to it, willing to try and do it with us. In the human side of things, loads of studies. Over in Croatia, we've got the physiotherapists that are actually using it as part of their thesis. And they're doing the research. We've had research done in the Cairns Hospital during COVID where the recovery move was used to help get people off fence. So the research is there, but as with everything, it's slow and steady. And it's for it to get the reach that the people need. Just tell me if I'm not answering.
No, you're
it's
absolutely
like I've got a lot
answering.
going through my
I love
head.
it. And that's the whole point of this podcast, is just to like go and do that type of thing. I love the fact that this is something that may have a positive result, even if I'm skeptical. So let's say I'm a skeptic, I'm a vet, I believe in medicine and so on and so forth. I'm not quite as rigid as that. But what I do like about it is it does no harm.
Yeah.
And I like the fact that it potentially connects, if we're talking the work that you do between owners and their pets, it connects the owner to visualizing and recognizing potentially what's going on, which can sometimes be a barrier.
It's like a self-responsibility model. That's how I like to word it. It's
Absolutely.
Like creating awareness and a self-responsibility. They'll keep bringing the dog to you and saying it's got this problem, but they can never elaborate further. So how's the vet or any therapist meant to actually help the animal if all they get told it's still limping? They don't get told when it's limping. Is it after meals, before meals, after jumping off a bed, the house floor, all of those. Yeah,
totally. I mean, we see it even within a practice, and obviously I'm not talking to my, every pet owner, but it resonates even with me with the dogs being outside. If one is off their food and I have to go, does it have diarrhea? I'm like, ooh, I don't know.
Yeah.
There are a lot
when
of
last
things
did
that
it poo?
I don't know. I didn't visualize that. There are different breeds or whatever, people who have more working from home or whatever it may be. But the one thing I see with the work that you're doing is the connection that it forms with the owner and their pet, and like you say, from a measurable response to it or not.
Yeah.
And obviously it is doing something, because you otherwise wouldn't continue to do it.
And the nice thing is it's non-invasive, and that we call it an easy-to-use light touch neuromuscular release technique. So when was it? 2 years ago, I taught a group in Brisbane, and majority of their course was actually a flyball team. So I was like, what's flyball? Coming from South Africa, not something that we hear very often in the dog sports. It is here. But it was really fascinating because they came, instead of taking the dog to the chiro all the time after competitions, because it's quite a harsh sport on the dogs, on their joints and that. But they love it. I mean, you must see these dogs, they go absolutely
lots
berserk.
of rotational movement.
Yeah, on the jumps, and they hit that board at the other end to get their ball. But they wanted to be able to help their dogs pre, during, and post-comp, so that their dogs had the best possibility, obviously within the competition, but also it reduced the injury as well.
And the recovery after.
Yeah, the recovery after. But it also reduced the expense as owners, because they weren't having to keep paying injury bills all the time. And it's led to them actually treating fellow teammates' dogs as well. So, and that's what we want, is we want people to be able to use it at home. Obviously, there's varying degrees. So, there are some cases where what we call a practitioner who's gone through the full set of levels, they've done an accreditation where they can work with the more complex cases as well. So there's a workshop, and then there's 5 levels. So we call the workshops just a 1-day, 6-hour pretty much. And it's just for the person wanting the very, very basics, and it's an intro to it. But really awesome moves to get you going. And then level 1 and 2 is the home care. If you just do level 1 and 2, you've got already an arsenal to be able to have your first aid muscle care for your animal at home. Thereafter, we start going into a bit more specifics, where you've got to be able to observe a little bit more, be able to understand movement, know the difference between breeds. I mean, a lot of people go, oh, that horse is lame, but they don't understand, well, that breed, that is how they walk, that's how they trained. And the same as with dogs and behavior. So we've got cattle dogs and Aussie Shepherds. So 2 totally different breeds, both high energy. And our Aussie Shepherd walks unilaterally. So same side, walks. And it's the amount of people that have asked me, is she okay? I'm like, that's just if you look at a lot of Aussie Shepherds, that's how they walk. So it's just to also understand all of those, what do you call it, like categories coming into it.
Absolutely.
Yeah.
And so, I mean, you talk about obviously a great example, South Africa, agility is a big thing. And a lot of South Africans really enjoy agility sports with their pets. But how early on can you be using this technique? Is it something that can be started in puppies?
It's very exciting. So my boss, I actually work for the Emmett Technique head office as well. I do all their data. So every course that's taught around the world, I capture that into the system for them. And so Ross's daughter, Lindsay, during Christmas, she was visiting her mom down in New South Wales, and they had a cat, I think it was a stray cat, came in, and she was pregnant and was trying to give birth to kittens, and they were stuck. So she performed it on the mommy, who then gave birth to the kittens, and then did the recovery move on the brand newborn kittens. Sure. So it's from instant. Another example of using it is like people go, there's a lot of things, for example, like physio. How soon can you do it after surgery? You've normally got a bit of a wait time. There's certain things you do with movement and that. With Emmett, we've got quite a few moves that you can do literally as they're coming out of the anesthetic to help that nervous system to switch back online and to process those drugs out. So we're not flushing anything with medication, but to help the body's innate intelligence kick back in and help them to recover quicker as well. So it's limitless as to what we can do. When I moved back to South Africa last year, I worked on a 12-day-old baby that couldn't latch. And the mom was getting mastitis, and she was at her wit's end. And they said, no, the baby's got colic, it's got this, it's got that. And it was a simple, literally not even a 2-second release on the neck. And baby has slept through every night since and hasn't stopped drinking.
Jeez.
So
I mean, there are lots of case examples that you can give, but what do you see as the majority of sort of applications of this? Is this the aging pet? Are these the pets with injuries?
It depends where your line of work is and who your target market is, as with anything. Like, you're going to get your vets that will, do sports dogs, or like your general pets, small, large breed. Because I've traveled so much, I've seen a lot of it. And when I teach, the students have been so diverse, from people where I've taught a course, they've got to level 3 and the dog's really old, bowel incontinence, can't move, can't get up. And by level 5, the dog's passed away, but they were able to give it so much relief just in those last, whether it was few weeks, few months, to the total opposite of where we've got, like the flyball team, for example. I have had some vets on the courses, and they're using it in practice. 2 actually in South Africa who've done level 1 dog and horse. The one's done level 2 as well. And she loves using it in the practice. She says, because it also just calms the animals as well. And what's nice is then you can give it as a home reinforcement to the owners. So obviously we don't, give moves away per se, but sometimes we'll show them a singular move to say, when you go home, do this in 2 days' time again if you see the dog, stiffening up or whatever the case is. And it just empowers the person as well to feel like that they're able to care for their animal. Because a lot of people feel very helpless. They don't know what to do, and they giving a tablet's one thing, but actually physically being able to do something gives you a total different sense of achievement and, satisfaction.
And I mean, obviously we are always concerned, particularly when handling painful patients, both in the consult room when the owners are present, that the owners are not bitten, but also for our staff members that they're not bitten.
Yeah.
You obviously, I'm slightly answering my own question by saying that this is not a sort of painful procedure or a painful technique, but how do you manage that in terms of an education perspective for the owners that maybe want to apply this, or for the people on your course?
So one thing we're very big about, so the Emmett logo it's normally yellow. So it's a chameleon. And it's because Ross refers it as to the chameleon approach to body therapy. We've got to be adaptable the dogs didn't read the textbook of what's meant to happen when that move is done to them. So when we do it, there are some moves. For example, if we had to do a hamstring release, ideally you want the dog standing so those back legs are loaded. But if it's an old dog that's got hip dysplasia, can't get up, you're going to adapt and put the dog into a position lying down or hold the leg at a different angle to be able to release the hamstring. And so with anything, if there is a pain site as well, we'll then go to the non-painful side, do the same move, and whilst the dog is processing that, gently go to the other side and release that painful side. Yes, there are some moves you just cannot get to the move you actually need, but a good therapist will know the moves that sort of cross over each other, or how, if you do know the anatomy, how those fascia trains and that are all connected, and that if you release something up here, it will slowly and gradually release further down. So, for example, our hamstrings connect into the glutes. So if you release the glutes, you're going to have some release at the hamstrings and vice versa. And especially on animals being quadrupeds, we've got a lot more to work with when it comes to that, as opposed to a human who's loaded straight upright all the time as well.
So is there behavioral teaching within the course in terms of sort of managing the response in order to avoid injury?
Yes. So big thing is safety. Before we even start the course, we give a basic history, of where the techniques come from, an introduction to who Ross is, what we're going to be doing. And before we even start any moves or what the technique, how the understanding of the technique is safety. So for the horse course, we've got a whole page and a half on horse safety. In the dog course, the exact same thing. And even though a lot of the people are sometimes very horsey or very dog, it's amazing when people are observing a point, they forget about safety, or you're looking at a horse, so someone walks behind it to see it get a better view. It's just when you're in that moment. So we reiterated at every level, that pages from level 1 to 5, and we go over it every course. Because an animal in pain reacts in ways that you cannot imagine. And when people say my dog doesn't bite, every dog bites. It's just a matter of pushing the button to make it bite. Every dog kicks, every horse kicks, every horse bites, and just never say never. So we are very much about the safety of it. We do also teach them to understand responses, what we call a jump. So a jump is an indication that they've either processed the information, taken on the move that we've performed, or that it is a warning. So understanding what are dogs' sort of actions or reactions that are like, I've had enough, so like you're growling, you're snarling, hackles going up, things like that. But then some of those can also be a taking on information. And as the students progress through the levels, we make a point of pointing that out as well. So you can get a horse that's like shuffling its feet a lot and can show irritation. But then at the same time, depending on the move you've done, if you've done something up in the withers, that movement might be a resettling of that whole thoracic sling again. So over time, we teach them to learn the difference between what is like, leave me alone, and this is now part of the process of what's happening. Okay. And that is part of our job as an instructor, to make sure the students know that. It's our job to make sure that they are safe at all times. And if there's a dog or a horse that I would not work on, I will not let the students work on that in a class. And the same is, even as a practitioner, if a dog is really vicious or a horse that kicks or bites, I'm not the behaviorist. Then go and take it to a behaviorist, and then I will come in and do my job. And that is one thing that we are very pro about with Emmett, is that we are not the be-all and end-all of everything. And we all know that when it's beyond us or it's not part of our scope, refer. So we try and make sure that we've got sort of a good network of different people. And before I left South Africa, I had a really good network of the vets, and that because we were up in Mooi River area. So I'm slowly building that whole network again. And even over in Oz, I made some amazing connections. We traveled the whole of Australia. And yeah, it's really good to know who your farriers are, who your physios are, your chiros are.
It's a community.
And different vets, whether it's an orthopedic case or is it dentistry or, is it a gut issue, is to know which vets, what are their specialities as well. And for me, it's more about everyone working together. This whole thing of isolating causes a lot of problems. And the only ones who actually suffers the animal in the end.
No, I agree.
Yeah.
And in terms of indemnity for the practitioners, I mean, do you get, because there is always liability associated with any work that you do, particularly, when you're dealing with sort of medical-based cases. Or
yes.
Do you have like a governing body or association that kind of looks after you guys as practitioners and advises you from indemnity, or has the sort of Emmett umbrella,
the brands and things?
Have they set up like an indemnity so that you can get owners to sign consent?
So it's country specific. All right. And we're in over 40 countries around the world. Some countries are, a lot more pro that sort of thing. Others aren't. In Australia, there's a thing called the IICT, the International Institute of Complementary Therapies. I'm a member of them. They do cover South Africa as well, because as with any complementary or alternate, as the word we used earlier, to try and get a governing body is really, really hard, because they don't understand the concept of it, because it's not a university course, or a technicon course. It doesn't fall under really any category. So it's up to the individual practitioners also to apply for insurance. So I do have insurance. I'm actually covered through a UK company through the IICT. Because when I was over in Oz, you're working on people's very expensive racehorses. The camp draft horses got upwards of $500,000 at some of the sales. That's like 5 million rand for a horse. So if you're going to do something, you got to be damn sure you know what you're doing, and to make sure that you're covered. And it's always a risk you take in anything you do. Sometimes it's not your fault. The beauty of Emmett, though, is if you choose a move and it's not the right move, it doesn't do anything. The animal responds neurologically to the move that is needed. And we talk about less is more. We don't do more than 5 moves in a session. Sometimes one move may be enough as well.
I think some of the concern with alternate therapies has always been, are these now having delay in treatment that's required potentially by veterinarians? You spoke about the fact that you've got very much a collaborative sort of effort with the community of whether it's farriers or physios or veterinarians. Is that something you teach within the courses to understand the limitations and to work in the best interest of the pet?
As an instructor, yes. Once they go out there, we've got no control, because people's egos get in the way. And that's in any industry. Once there's something that's working, they just want to, go with it. But it's 100% something that we do teach. And we actually draw up like a diagram going, okay, there's your vet, there's your physio. This is us. We literally the home first aid kit. When the bandage is no more working, go, and we'll say to them, go to the vet. Or often I'll get students ask me something and say, I've been practicing on a dog and this is happening. And I'm like, no, that's beyond our scope now. You need to tell them they need to seek other advice on it. And I myself, I'll even phone the vet. So we've got a few vet friends and I'll say to them, I've got this case. What are your thoughts on that? But it's to try build that collaborative network. And I think that's where it's lacking a lot is, like you say, the vets are very scientific and it's all got its place. But it's to understand where each one's coming from and allow them the opportunity to either demonstrate it, do a few cases with them, and then make a decision on it, not just rule it out because it's so basic and so simple, if that makes sense.
It does.
So, we've seen, and I know you're into the nutrition as well. So we've done a lot of raw feeding with our dogs for years. And when we first started, people literally frowned at us. Now that whole mindset's changed into how feeding is working. And it's not necessarily in raw, but just in general, what dogs need. And nutrition's become a huge player in animal healthcare, period. Whereas previously it was just buy a bag of dog food and make sure the dog was fed. And now understanding your breed, the performance and everything changes your mindset, same as us.
Having taken more of an interest in connecting with that animal and as an individual. My brain works in a very strange way. But I obviously, considering this kind of therapy, I think, okay, for me as a practitioner, where would I see this be needed? Is it the fact that it's, like you say, your first aid kit at home and this is, you start with this and failing that,
Are you talking fitting into like as a vet, where would you fit it in?
Yeah. So okay. I'm kind of, me being a vet kind of going how could I see this as something that I would want to be involved in or use with my own pets. And I think, first aid, I love that concept of saying, there is very much people are financially limited, like you said, sometimes it's a financial limitation, and sometimes also having the ability to be able to do something at home, placebo or not, I love the fact that whether it's the fact that over some time they come right, or this technique, I'm very open to this, or whether it's complementary to the veterinary care that you're getting, or whether this is like you've done everything. We've done everything we can as veterinarians, and we have to take a non-judgmental approach to this. There obviously cultural beliefs or family beliefs where people are not necessarily wanting, say, to euthanize or wanting to support their elderly pet, and we're doing what we can in terms of pain relief,
the resources,
and to say, well, look, let's be open to trying to manage this holistically. I'm going to use that word. So I like the fact that there are certain places I can see that this can be a collaborative way, even in terms of if you are working with a practitioner, potentially a lameness, that says to you, you need to go and get this x-rayed. Sometimes hearing that from someone else is really beneficial, because if it's going to work and come right, it will come right. But if it isn't, then it's quite clear that it needs more investigation. So I am, not so arrogant, and I don't have such a huge ego that I don't open discussion on alternative therapies, particularly when it can aid and it can increase the connection and bond and interest that owners have with their pets and involvement in their care. We find even, if it's a case of behaviorally, that if owners are spending more time with their pets, they like you said, you recognize when something's not wrong. You are able to administer medication if that's what's required for the pet. You will manage your home environment. You spoke about slippery force.
Just be more observant to things.
So, the fact that, you're teaching that a lot of the things, we come from the same sort of wanting to meet the pet's need, and we have a lot of things in common in terms of wanting a positive outcome. So I am very open to that. I think the fear is always in doing more harm, and I think that's probably where a lot of the fear comes in, where veterinarians or people who are so skeptical about alternative treatment. But really, if this is one step in the right direction, and it's working for a particular owner, who are we to? Who are we to
and
judge?
we're not doing manipulation. You're not inserting needles. You're not applying balms or oils or things that you don't know what the animal's going to react to. And when you said behavior, there was a case 3 years ago up in near Toowoomba on the East Coast. And a lady called me in. So I kind of felt set up afterwards, but she called me in and she had a border collie. And first thing I observed is the collie had collie nose. So sort of like that lupus. And I said to her, do you keep an eye? Because the sun is really harsh over there. But this collie literally ran circles. It just couldn't sit still and was going all the time. Anyway, and I said to her, so why am I here? Because I kind of felt like I looked at the dog and I'm like, okay, you're a border collie, you're excitable, you're on a farm, this all makes sense, but I don't see anything physical, and the more I spoke to her, anyway, I kind of went, okay, well, we're just going to do a spinal balance. Let's just see if we can regulate your nervous system and get that sorted. Anyway, and literally sat on the floor, and then the dog would come lie there. I'm like, okay, we'll do that move. The dog would walk off, come back. And then afterwards I said to her, why am I actually here? Because she just said, treat what you see. Anyway, it turns out she had just done the horse course and she didn't know what to do with this dog. But she also had that whole thing of like, does this really work? When you do it and you see it and the instructor's doing stuff and the horses respond, you kind of like, okay, cool. And what I found out afterwards is this dog literally herds everything. She's put up perimeter fences. Well, it's like those collars, where it's got the, because otherwise she just goes off and herds everything on the farm. And her behavior was erratic, and they had a child. And just the 3 moves that I did based on what I was seeing and went, okay, the dog kept coming and presenting, because animals are smart. They also know what they need if the person's got the tool for it. And 3 days later, she's like, oh my gosh, this is a different dog. So I was shocked. Oftentimes I go to do a treatment, I do the move that I know is appropriate for what's presenting and go, gosh, I don't know if I've done the right thing, only to find out that the horse is competing at the show and clearing the 80 centimeters that it hasn't been doing for weeks. And that's one of those things you never know unless they give you feedback. So it's really important to also follow up. And that's one thing I make a point of. 3 days after a treatment, I'll follow up. And then a week after that, I'll follow up again. And to make people aware, okay, so this is what we treated because, and I don't know if you have it, in just the veterinary practice as well. They'll come in for one thing. You address that. 3 weeks later, they come in. How's the dog been? Oh, no better. What's the problem? They give you a whole different problem. The one that they came in for originally is now gone. So they don't notice the progress that's been made. And there again, that's where that whole self-responsibility model comes in, is bringing the owner's awareness to, okay, well, the dog couldn't jump on the couch. Now the dog is able to jump on the couch. We've just got a bit of a limp. But when is the dog limping? Okay, after jumping off the couch. So this whole scenario has changed. It's not the dog's not better. We've got a whole different issue at play. So sometimes it's just a failure of being able to communicate what is actually happening. And that's one of my, I don't know if every practitioner does it like that, but for me, one of mine is to also just educate the person.
So it's a strength,
as we go.
Communication.
Yeah, to say, okay, this is what we've done. Potentially be aware the dog may do this. Take note of, these stool habits. Are they weeing more often? Are they drinking? Are they eating? Are they eating quickly? Are they eating slowly? All of those can show you different changes as well. Knowing the difference in the coat, it's really interesting. We had a Labrador last year up in Nottingham Road, and her coat goes all curly. But when she's well and healthy and all the muscles are all happy, her coat goes all nice and smooths out. So we can even observe just by the way the coat is contorted as to what's happening under the skin and be able to work with that. So the observation's not just the behavioral. We're looking at what the legs are doing, listening to the nails ticking on the floor. Is there a consistent walking pattern? Things like that. Looking at the dog. Are the nails up like this? So are those claws, are they actually able to knuckle over? So there's a lot to it. And I suppose, so one of the vets that I actually had over in Australia, she by lunchtime on the first day, she was in tears and walked out of the course. Lovely, lovely girl. And I went out and I said to her, is everything okay? And she said, I spent 7 years of veterinary school. And these laymen understand what you're talking about. And I feel like this is going straight over my head because it doesn't match up. The beauty of it is she had a beautiful big Great Dane, and she had brought him to course. He had been attacked by other dogs previously, so was extremely reactive. So we had him in a crate. And on day one, any dog walking past the crate, he just wanted to go for them. I said to her, come in, let's finish the course. I used her dog as a demo because I was aware that it wasn't one that I'd want the students to be working with outright. By day 2, when she walked in with the dog greeted every dog, went up to every other cage. She proceeded to go on to the second level, and it was just still like that whole scientific brain doing this, just couldn't gel it together. But the beauty was she brought the dog to level 3, 4, and 5 for us to use because of the benefits her own dog was getting. She's like, I cannot understand it. I can't comprehend it, but I cannot deny the results my dog's getting. And yeah, he had been with her right through vet school. I think he reached like 15 or something. Wow, that's good and age. About a year and a bit after the course, he passed away. But she was able to take him to the beach again, go off leash. Obviously certain breeds of dogs, they run in with it like an aggressiveness. He'd tense up, but totally, totally different dog. He'd lie there and play with the other dogs. So that's not placebo. And she had just said she can't understand. She's done so many things with the animal behaviorists. They've tried everything. She's tried meds and it didn't work. And literally 2 moves on that first day and it changed something in the dog. It's not to say that those same 2 moves are going to work on another dog because it depends what the trigger was to create that state initially. And that's the beauty of Emmett. You never know. It's like a lucky package. Yeah. What you're going to get out.
It sounds like a lot of information for, and again, I speak totally respectfully, but I mean like a lay person to get in a couple of days, even down to a good communication. I mean, you obviously are well practiced, very experienced with what you're doing. And so to follow up with owners, maybe how to approach certain things, potentially when you're being set up. But this is something that in a short course, it's a lot of information to take on. How do you support your students after they...
So they don't just go and practice. Okay. So and that's one of the things that, I've done a lot of courses, like with the kinesiology. I did the equine bodywork course and that. So I've done various courses over the years. And there's a lot of courses that, have like different levels. You do level 1 and that's done and dusted, sweep it under the mat. Then you come to level 2, start the new work. They don't check, did you understand level 1? So the beauty of Emmett is every move you learn can be used immediately. You are not a practitioner, and we make that very, very clear. Practice on your own and maybe your friends' dogs. You're not allowed to charge. And we explain to them, what happens, what they should be aware of, what to observe for. And it sounds like a lot, but when you actually do a course, you realize it's not as overwhelming. So they do the level 1. When you come back, and if you choose to do level 2, we review the whole of level 1. And they get to come back with all the questions or concerns that they may have, or if they weren't sure of moves, we correct all their positioning from level 1 before we start the new work of level 2. And the same happens at level 3. We review level 2 and any residual questions from level 1. So every level we go up, we do a full review of the previous level and potentially the previous level, before that. We try generally have sort of like a Facebook group or WhatsApp group. The students can contact the instructors at any time. They can ask on the student groups as well. We do encourage them to take videos of a before and after as well, from a learning thing just for themselves as well, to see. Or if they're not sure, send me a photo of your hand position, because the common question is, please can you do a video of how to do the move? Watching me do it's not going to help you learn it. I need to see what you're doing to be able to correct you or to help you get to the right position. So there is definitely a lot of support with it as well. But again, we can only do so much if people don't want to take the support, or make the call. Fortunately, touch wood, I've been very fortunate with all the students that I've had and am in contact with majority of them still. Quite a few practitioners have gone out and getting amazing results, have left their normal job because they just wanted a change, and they've gone and they're doing that full time.
So how do you know that you have got a qualified practitioner? How can you, if this is something that you want to, call in a practitioner to what are the kind of, without sort of like a governing body or whatever, you can't sort of check with an association whether they are. So to reach practitioner level, you've got to have done all 5 levels. So the animal courses, there's 5 levels. Once you've done all 5 levels, you've got to do your accreditation and client clinic day. And the accreditation is basically obviously a review, putting you in a scenario to treat a horse or dog as you would do a client's animal. And in the client clinic days, running them through your different types of scenarios, or you get that stroppy client, what do you do with that? Being able to, it's not just handling the animal, it's handling the person as well. So Ross talks about the 7 A's. So we look at your attitude, your atmosphere, your appearance. There's a whole variety of things that we look at. There is the Emmett Technique website, the international website, and practitioners cannot be on that, or people cannot be on that website unless they're a practitioner. So you can look for that name.
It's a paid listing. Some people choose not to, be listed on it, and they are practitioners. But if anyone is ever concerned, is it an Emmett practitioner? It's as simple as emailing the info@rossemmett.com.au email address, and immediately we'll look into the database and go, no, that person's only done up to level 3. They're not a practitioner. They are still a student. So
it's quite important that people, in order for their pets to be safe,
100%.
They're not, paying for a service that is not by a qualified practitioner.
And we say to the students as well, so with the RICT, to be able to get insurance, they can get insurance as a student from level 4, because obviously you've got to practice. You've got to actually be hands-on practicing. It's a hands-on technique. So it's not a matter of learning out of a textbook and then, going applying it once you're qualified. So we encourage them to practice on their own, friends and family, animals. And then from level 4, you can go and offer it out there at a donation. Let people pay what they feel it's worth. And one thing that we've learned over time, and that's how I learned as well, was if people are getting results, they're not just going to take it for nothing, because it's an exchange. And it also gives you a good idea of where they will base, once you are a practitioner, where to start your charging as well, because people will pay. If it's worth it, they will pay you for it. And again, it's country specific. Over in Australia, people will pay for a chiro for their animal before they'll pay for themselves, because like horse sports are really, really big over there. The dog sports are very, very big. But again, country economy, South Africa's not in the same boat. Certain European countries aren't either.
So you're back now in South Africa.
Yes.
You are not only a practitioner, but you are teaching the course.
Yeah.
How do people contact you? Where do they get more information on this? I mean, you mentioned there's a website. Obviously, we'll have it attached to the details of the podcast. But if they're wanting to hear more about it, understand it better, they either have a pet that they're interested in having treated, or they want to become practitioners.
Yeah.
How do they reach out to you?
So I have got a website. Disclosure, I'm not a techie person. So very at home. It's got the basic information that you need with contact details. But there's www.Intune Animals and Humans, all one word, .com. And then I'm on Instagram as well, Intune Animals and Humans, and on LinkedIn. And then they can email me. It's just intune.animals.humans@gmail.com.
Fantastic.
Or via WhatsApp. And then there is, like I say, the Emmett HQ website, which has got all the details on. They have got an events calendar and a course calendar, which lists all our courses internationally by country, and then in subcategory horse, human, dog, or cattle in the European countries. We're hoping to get a cattle course going here in South Africa. I've just got to find the right venue to be able to do it.
Oh, fascinating.
Yeah.
Thank you for taking the time to speak to me and being really open to my line of questioning. It is super fascinating. And I mean, obviously we can follow your journey in terms of some of the case examples that you give. Being on social media obviously gives you a certain level of accountability that and you've got testimonials from clients who have truly sort of benefited from the work that you've done. And it's been a really interesting conversation, and it's good to have you back in South Africa.
Thank you. I look forward to it, and I hope to see it more like in things like the vet nurses and that, where it's a tool in the toolbox.
Absolutely.
Emmett's just another tool in the toolbox.
Nice complementary.
It doesn't, like I said, it doesn't take over anything. It just complements, and it can be in anyone's toolbox if they so choose to use it.
Absolutely.
Yeah.
Thank you very much, Heidi.
Pleasure.
Thank you so much for tuning into today's episode on the Paws Effect podcast. If you found the discussion helpful, please like, share, and follow our podcasts. Don't forget to leave us a comment or review. We love hearing from our listeners. Remember, you can listen to us on your preferred podcast platform. Welcome back to Just for Pets. You're with Dr. Cara.
Hi, Doc. It's Justin the Jack Rossi here, and boy, am I itchy.
Are you on a hypoallergenic diet?
Hyper what now?
Changing to a special diet will really help. And Just for Pets have a massive range. And flea and tick medication, special shampoo.
Ooh, how quick can you get some?
Order today and we'll deliver pronto.
I feel better already.
Justforpets.co.za. Vet approved, pet adored. Get it all to your door.